What is Health Insurance Portability and Accountability Act of 1966, HIPAA? HIPAA is federal law protects the privacy of a person's health information, making healthcare communication confidential. Verbal or written information must not be obtained by an unauthorized person. Aides should not discuss any patient's situation with another patient, even if the patients are friends. Should not discuss other patients with nurses, either on phone or in person, while in another patient's home. Should not talk about a patient over the phone if there is anyone who might overhear. If another staff member calls you at a patient's home, never say anything that might identify the patient. And never discuss a patient in public spaces. Never discuss a patient's condition with anyone such as a neighbor or family member without patient's consent. If you are unsure of who the patient has authorized, ask the nurse or your supervisor. All paperwork taken into a home should be kept confidential. Guard your notes and other papers so that no one else can see them. Do not put papers containing patient information into garbage. Shred all documents. There are some exceptions. For example, caregivers are obliged to provide relevant patient information to 911 operator or medical personnel in case of emergency. And caregivers are required to report reasonable suspicious elder abuse and child abuse. The ordering or performing of an HIV-related test requires written informed consent from the person lawfully authorized to consent on a form developed or approved by the New York State Department of Health. Such testing can be performed without informed consent only in very limited circumstances. A general consent for release of information is not sufficient to permit the release of HIV-related information to anyone but not falling within the list of persons to whom disclosure can be made. A specific informed consent developed or approved by the New York State Department of Health is required for release of HIV-related information. Aides should know that once any HIV-related information is disclosed to you, you are not to disclose this information to another person except as authorized by law. You should understand that you are subject to a fine or criminal penalty as well as disciplinary action by Golden Touch Home Health if you perform, permit, or procure the performance of an HIV-related test in violation of the Act, or if you disclose or force anyone else to disclose HIV-related information in violation of the Act. You need to inform Golden Touch Home Health within 10 days if you disclose or authorize oral disclosure of HIV-related information. The penalties for noncompliance are based on the level of negligence and can range from $100 to $50,000, with a maximum penalty of $1.5 million per year and imprisonment for up to 10 years. Medical fraud and abuse. Medicaid fraud occurs when a member or provider knowingly cheats or is dishonest, resulting in a benefit such as payment or coverage that would not have been provided. Examples of Medicaid fraud: knowingly billing for services or supplies not provided. Defrauding the federal government and its programs is illegal. Committing Medicare fraud exposes individuals or entities to potential criminal, civil, and administrative liability, and may lead to imprisonment, fines, and penalties. Advance directives/hospice. Golden Touch Home Care supports and respects each patient's participation in their own healthcare decisions, which is the right of New York state law. Golden Touch Home Care has specific policies and procedures to ensure that patients have the opportunity to participate in their own healthcare decisions. Golden Touch Home Care assessment nurse will discuss with the patient concerning advance directives during the initial assessment and record it in the patient's medical record. The following is the documentation. Advance directives. Advance directives is a written document that provides instructions on the patient's medical choice when the patient is unable to make medical decision on his own. Healthcare proxy. If you can no longer make decisions and speak for yourself, appoint another adult as a healthcare agent who can make healthcare decisions on your behalf. No resuscitation order or DNR order. It is an order written by a doctor because of the request of a patient or family member to not perform CPR. The order and instructions indicate that even if the patient's breathing or heartbeat stops, doctors, nurses, and/or emergency medical personnel will not attempt emergency rescue. Living will. It is a document that states the medical care and treatment you want or do not want when you cannot make a decision. Remember, when someone is admitted to hospice, caregivers are expected to call the hospice emergency number, not 911.